Hello and good morning. This is Kuldeep Chaudhary from Health in India. We are here in the chamber of renowned interventional cardiologist Dr. Niraj Kumar at the Alchemist Hospital in the city of Gurgaon. We have come to find out from Dr. Niraj and some of his patients what exactly goes in the treatment of heart and how heart care is being managed not only in Gurgaon but in India. And what the patients have to say about Dr. Niraj, because we've been covering Dr. Niraj Kumar and his practice for the last several months, and we've seen that the patients have a lot of good words to say. We'll try to understand how Dr. Niraj practices cardiology in a different manner, because there are lots of doubts in the minds of the patients these days about what cardiologists recommend, what is the right thing to do. And so we are joined here by Mr. Seth, who's a senior citizen, who's been a patient of Dr. Niraj for several years now. He presented to Dr. Niraj with some chest pain, and Mr. Seth, who himself is engaged in a lot of health activities with senior citizens. He takes care of patients who suffer from Alzheimer's disease. He's a very, very active social worker even at this ripe age. So Mr. Seth, I would like to ask you, what difference did you find when you met Dr. Niraj?
Well, normally when I had a heart problem, I went to a local hospital, and after initial tests they said that it looks like a heart problem. It was almost at night, 9 o'clock, and they took my permission to call a cardiologist. Then I didn't know Dr. Niraj at all, but he came immediately, and he saw all my reports, examined me, and he said you need an admission for further tests in the hospital. I am generally very wary of hospitals, and I don't believe that I could be having a heart problem, but so I refused to go to the hospital. I said I will not get admitted in the hospital. To my surprise, Dr. Niraj did not insist that I should get admission, that he will not take any responsibility or things like that. He said, look, we never force a patient, and so it's okay. We will give you some medicines, and after that in the morning maybe you can give me a ring and come to hospital for a further checkup. So he was so persuasive that my resistance almost broke, and I started to have a confidence in him. And then I came to know he was in Alchemist Hospital. In the morning I went there, and then he put me through an ECG, and then I had to take admission in the hospital because the ECG was not too good, better than before, but not too good. Now after that, angiography was done, and after angiography again he said there are blockages and angioplasty will be necessary. But then again we decided with my family that we would like to consult another cardiologist, and after that only we will take decision. Again, to my surprise, he very cordially agreed, and he said, yes, you are most welcome, take an advice, be confident. So after taking it, they closed down everything, the procedure, and next day again, same procedure was done, because the doctor whom we consulted was also an eminent cardiac surgeon, and he advised that I should undergo angioplasty. So the angioplasty was done, and after a couple of days I was released from the hospital.
Dr. Niraj, you've been practicing this thing of, being cooperating with the patients, not pressurizing them to get admitted or to get a procedure on an emergency basis. How difficult it is to practice cardiology and to become, become a leader in that numbers game where people run after doing 100, 200, 300 angioplasties a month?
See, first, before replying your query, Kuldeep, I will take the liberty to tell you one thing, that the message is that once the patient is wheeled in the emergency room of a tertiary care hospital with chest pain, it is never an emergency, is probably not a right statement, because when a patient is having an acute heart attack, that means by the ECG and by the symptomatology, we know that the artery has been closed down by a clot formation. That is a real emergency, particularly when we expect a large artery being occluded. And at that time, many a time, I force the patient, I try to convince them to my level best that we will talk later. If you have faith in me, this will be a rough expense, but this will be a life-saving exercise. Maybe in 10-20% cases, I go beyond that. Usually I think is right to go for a doctor when he is meeting a patient or his family for the first time. But in 99% times, once a procedure is done and then I discuss with them in detail, then I find them agreeing totally and they have full confidence in me. However, you are right that in many a situation when there is an acute coronary syndrome, means there is some problems going on in the ECG, patient has symptoms, but his hemodynamics are stable and it's not a complete or acute heart attack. In that kind of a situation, definitely the pharmacotherapy in many of the cases stabilizes the patient and patient has the time to think. As per, if we do an angiogram and we see that we are in the window period that is within 4 to 6 hours of an heart attack, and the patient has an occluded artery, and if the patient says that we want a second opinion, probably I will go out of way to convince them that don't do that, have confidence, let me open this artery first. Then you take 10 of opinions, and if I have done something wrong, come back and whatever you will say, I will be agreeable to that. But if the artery is open, it is flowing, it may be a 90% lesion, if the patient is not convinced or doesn't have enough confidence at that very moment, I always tell them that it's perfect with me that first they should generate the faith and they should have this confidence that whatever the treatment is being offered from this modern medical world or this tertiary care center is good.
Okay, very well said, Dr. Niraj. You didn't agree with me fully. What I was trying to come to another point is that lots of people have now started calling it stent custom. So, you know, and I've always failed to understand in my communication with various cardiologists, you know, you have a Yukon stent which costs just about 65,000-70,000 rupees, and you've got a Cypher stent which costs almost double the amount. I've always asked cardiologists, are there any studies which puts one stent over the other? Nobody has been able to answer that. Everybody says, you know, if it's more expensive, it's bound to be good. What is your take on, but whenever we have said that the patient can't afford it, they're willing to go with the Yukon stents also, or you know, similar stents which cost the same amount of money. What is your take on, you know, which stent is good? And what percentage, are there any studies about it?
See, there are studies and most of the decisions are taken by evidence-based data, that is statistical data, and no stent usually gets launched in the market without enough data on the animal experiments and then on human trials. Then only some stent gets a permission to be put in a human body professionally. And there are, I don't like to name any stent, but there are groups of stents which are considered better as of date. There are stents which are considered of the middle range, and there are stents which are just, we know since we need a stent to scaffold the artery when we have opened it, so any stent can do that immediate job. Mainly you will ask me, the stents are technically divided into two groups. One is medicated, one is non-medicated. There are other ways also by their anatomical platform, which metal platform is that, what is the stent strut design, what are the strut sizes, that in fact leads to its strength, its radial strength, its trackability to the artery, to the tortuous lesions. But mostly it is medicated and non-medicated. Medicated stent have less chances of re-narrowing at the same site, whereas non-medicated have little more chances of getting a re-narrowing. That's the difference. Immediate purpose is the same. So the stents which have more trials and robust data are costlier. The stents which have less number of trials and less robust data are priced in between. Plus, it also depends on from which country it is getting imported and what are the logistics behind that. And then the third comes the non-medicated stent. There also are group of costlier, little less costlier. So I think the pricing and the technicalities involved, I don't challenge that. And if the affordability is there, definitely the best stent should be put. As far as the decision making about costly or not so costly stents is concerned, it also depends on patient's clinical profile. Is diabetic or not? How are his arteries? And mostly it is decided about that what is the caliber of the artery and what is the anatomy of the artery.
Okay, you have explained, I think, it quite well. May I now ask Mrs. Seth, when you took your husband to the cardiac emergency, obviously every family would be very, very anxious, and did you find Dr. Niraj comforting enough that you can put your trust in him?
Yeah, he explained us very well what is the problem and what the problem is having, why he is having all this problem. And I was convinced. And when I had seen him also suffering, I knew that it's something to do with the heart, because he was a little bit perspiring and all that. I gave him this medicine, Sorbitrate. He started feeling better. So I knew that something is there, so we should go ahead and get that thing done.
The doctors with whom I worked, he used to say medicine has to be more ethical than any other business, because a patient is giving his body to you. As long as the patient or a person can have control over his body, doesn't need anybody. But if somebody is giving their body to you and trusting you, that's just next to God. So I hope we have been trying at Health in India to highlight all the bad things about the healthcare, trying to improve the healthcare. We hope, by bringing your viewpoints to the world, we'll be doing a lot of good service, and we hope you continue doing cardiology, you continue practicing cardiology in the most ethical manner. Thank you, Dr. Niraj. Thank you, Mr. Zain.
Kuldeep sir, just I like to make a comment that the patient doesn't just entrust their body to the physicians or surgeons. They entrust their mind, they entrust their faith, they entrust their entire trust on the medical fraternity to that particular medical professor. And he should be taking care of all of them.
So that's a very big responsibility on those shoulders of the doctors. We're very proud to have you, Dr. Niraj, amidst us as a cardiologist, and we wish you very, very well in the future to emerge as one of the best cardiologists in India. Thank you, Dr. Niraj. So Niraj, who gets a large number of international patients coming from all parts of the world, especially from Africa and the Middle East countries. We are here with an international patient of Dr. Niraj who's been getting treatment for quite a long time, Mr. Musa. Mr. Musa, if I may start, which country you have come from?
I'm coming from Nigeria.
From Nigeria, yeah. Wonderful. Which city in Nigeria do you stay?
I stayed in Abuja.
Abuja, the capital city?
Capital city of Nigeria.
Okay, so what brought you to India?
I'm here for medical issues.
Medical issues for yourself?
For myself.
Okay, what exactly was the problem?
I have a heart problem, which is a bradycardia, I think.
Okay.
Right.
So how did you come to know about Dr. Niraj, sitting there in Nigeria?
Yeah, I know about Dr. Niraj through mail. So from there, we've been communicating to how to come to India. God so kind, Dr. Niraj have tried a lot. He sent medical invitation visa for me. I requested for my visa. From that time, I came to India. That was 2008.
Okay, so you're coming to India for the second time now?
No, I'm coming to India for about 8-10 times now.
8 to 10 times now.
All to see Dr. Niraj.
That's great. Do you feel happy and satisfied with the treatment
Yeah,
that you
I
get?
really feel happy and I'm satisfied with his treatment to me.
Okay. And what do you think of India as a destination for health? Do you find it expensive or do you find it
Actually, it's not. I didn't find it expensive. I find it very good. I can afford it, so that's why I'm always coming.
Okay. Now, what message would you like to give to the other patients who need good quality medical help about how to select a good doctor in India, how to select a good hospital? What should be their methodology?
Actually, I can't advise my friends, my relatives, whoever I know, or whoever wants a very good treatment, more especially cardiac patients, to quickly look for Dr. Niraj wherever he is, so that he can treat him good and can take him as a friend.
Niraj, you must be getting lots of telephone calls and emails from international patients. What barriers do you think are there? Are all the patients able to communicate pretty well in English, which is your language of understanding, the common language of understanding?
Mostly if they communicate on telephone, obviously if they know English, then only I can discuss the things with them. But otherwise they write down their mails or they contact the interpreter. And the interpreter then tells me about what exactly he wants to know.
Niraj, you are a senior consultant at the Alchemist Institute of Medical Sciences, which is renowned for its cardiac care. Would you like to tell us a little bit about your department, the facilities that you have, and your team members?
We have Alchemist is a multi-specialty hospital with super specialties available. The main area of thrust is cardiac care. And the Alchemist Institute of Cardiac Sciences boasts of very good surgical team, a good team of interventional and non-interventional cardiologists, and around-the-clock cardiac anesthesiologists manning the ICCU. There are intensivists and emergency care specialists who man round-the-clock the heart command, or you can say the emergency room, as well as the ICCU. The team of technicians, cath lab nurses, the ICU nurses is simply wonderful. And obviously the other super specialties are there to support the cardiac care, the neurologists, neurology, nephrology, the surgical partners, and general physician, pediatrician, gynecologist, all are available around the clock.
So, Alchemist Institute of Medical Sciences, which is situated on the Golf Coast Road, it's about 10 minutes drive from the international airport. It's surrounded by, all the posh localities. It's a wonderful facility which is located in the heart of Gurgaon. This facility offers best cardiac treatment, not only for all the Indian patients, but for the international patient. A testimony to that is Mr. Musa, who's flown to India 8 times, by Mr. Shailesh, who's come from all the way from Bihar with one of his relatives. Dr. Niraj gets patients from all parts of the country and from all over the world looking for the best cardiac treatment available. Mr. Shailesh, who works in Gurgaon but hails from the Hajipur town of Bihar, is accompanied by his brother-in-law, Mr. Naresh, who's got some cardiac problem. He consulted a large number of cardiologists back home there, was thoroughly investigated but still not finding relief, so he took advice from his relative who stayed in Gurgaon as to who the best cardiologist is. Since Mr. Shailesh had got his father-in-law treated by Dr. Niraj and was very satisfied with the results.
My brother-in-law was having serious, I think he is having problems since last 1.5 years. He went there, we meet our doctor. Like, he is having some kidney problem also, some liver, and full body swelling was there, body weight was increasing. So I don't mention name of good doctors in Patna, but very sorry to say they treated him badly. They told nothing is there, you just given some medicine, but nothing was happened. So I called him here. first we went there in AIMS, knowing बहुत ज़्यादा प्रॉब्लम होगी, अगर एक्सपेंसिव होगा तो बेटर वी गो देयर, बिकॉज मुझे लग रहा था शायद किडनी का ऑपरेशन होगा, लीवर का हो सकता है. वहाँ पे एक डॉक्टर थे, he was also from Bihar. He suggested me meet first cardiologist, any cardiologist. Then I called Dr. Niraj from there. He told me आप आइए देखते हैं फिर. And month back इनसे दिखाया है इन्होंने, he did lot of test and other thing, all test has been repeated. जो पटना में जो निगेटिव आया था वो यहाँ पॉजिटिव है, लाइक बस थमा इन्होंने ट्रीट किया है और तो कुछ ऐसा सच निकला नहीं है, बट इन्होंने एंजियोग्राफी भी किया बिकॉज TMT वाज पॉजिटिव एंड आफ्टर one month medication he lost around 2.8 kg weight and he is feeling very well. He was even not able to move in good way. अगर थोड़ा सा भी झुकते थे तो इनकी सांस बहुत फूलती थी.
वापस बिहार जाने की तैयारी कर रहे हैं, तो क्या आपको लगता है कि आप पूर्णतः स्वस्थ हैं अभी?
पूर्ण तो नहीं है, लेकिन हाँ
इलाज से फायदा हुआ है.
हाँ 60% ठीक है.
अच्छा, डॉक्टर नीरज, जरा हमें संक्षिप्त में बताइए इनकी समस्या क्या थी और आपने किस तरह से इनका इलाज किया?
In fact, his BP was uncontrolled. He had very high BP for quite some time, and very high BP usually leads to thickening of the heart, and the heart becomes, although the contractility of the heart is good, but the relaxation properties are not so good. So many a times there is a heart failure kind of a situation, although the contractility is good. Normally we mean heart failure means the heart is not pumping adequately. But sometimes that heart is not relaxing adequately so that the blood can come in. That is termed as diastolic heart failure. So it was that situation, that's why he was having a lot of shortness of breath, he was having body swelling, and along with that I had some doubt by the history that he may be asthmatic also. His renal function was borderline deranged, his liver function was borderline deranged, and all of them in my clinical sense was because of the heart failure. So I investigated him for the routine reasons like hemoglobin, his thyroid function, renal function, liver function. I did an echo myself and I saw that whatever my clinical judgment was, it was true. He had severe concentric LVH, that is thickening of the heart with marked diastolic dysfunction. As well as when he improved with the treatment of congestive heart failure and his BP was much better. When he came it was near about 180, 190. By 110, 120. When it came down to 150 by 90, then I got a treadmill done because there was some atypical chest pain and mild shortness of breath. Many a times it may be due to critical blockages in the heart's arteries. And his pulmonary function test showed that he has bronchial asthma, so the treatment of that was also added. His renal function, liver function, everything improved within 2-3 weeks and his BP got controlled. Gradually his congestive heart failure symptoms improved and he is symptomatically much better now. One thing that is his TMT also came positive and I did an angiogram. Angiogram showed some blockages but none of them were more than 70%. That's why for that also I had kept him on medical management only.
Okay, thank you Dr. Niraj. What we understand from this is that when scientific-based, evidence-based medicine is practiced at these wonderful hospitals where you're sitting right now, patients from far-off places, they don't really need to have relatives out here. They can contact the doctors directly and get the best quality of treatment. We hope that the kind of treatment that you've given, Mr. Naresh would be able to lead not only a healthy life but a very active life. Most of his problems would get sorted out. So there is a message from patients from all over the country. Look for good doctors. Look for doctors who give time to you. Look for doctors who will proceed in a multi-faceted manner, not only look at their own specialty. We have one such doctor right here, Dr. Niraj Kumar, who in spite of being a cardiologist, takes care of his patients in totality. Thank you, Mr. Shailesh. Thank you, Mr. Naresh. Thank you, Dr. Niraj, for telling Health in India about all this.